Welcome to The Explainer. Today, we're diving into one of the most incredible relationships out there, the constant, deep conversation happening between your mind and your body. It's something we all feel every single day, but maybe don't fully get. So let's start with an experience I am positive you've had. You know that feeling, right? That flutter in your stomach or that thumping in your chest? That's not just a saying. It's a real physical thing happening because of what you're thinking and feeling. It's your mind and body connected and communicating in real time. It's the mind-body connection in its most basic everyday form. And usually those feelings pass. But what happens when that conversation goes wrong? When it becomes a source of real distress? Well, that can lead to what are called behavioral syndromes, conditions where our psychological pain actually shows up in very, very physical ways. And using a key psychiatric text as our guide, we're going to walk through a few of these. First stop, our relationship with food. It's hard to think of a better example of how psychological distress can totally hijack a basic biological need. These are really complex disorders, and the first step is just understanding what makes them different. So let's clear up the difference between two of the most commonly discussed eating disorders. With anorexia, the key feature is being significantly underweight because of a refusal to maintain even a minimum normal body weight. Now, with bulimia, it's a bit different. A person is often at a near normal weight, but they're trapped in this destructive cycle of binge eating and then trying to undo it. So you can see, body weight is a huge clinical clue here. Let's dig a little deeper into anorexia. We're talking about an intense, overwhelming fear of gaining weight, a fear that doesn't go away even when someone is dangerously thin. And this is driven by something called a distorted body image. It's not vanity, it's a genuine inability to see one's own body as it truly is. It's like looking in a warped mirror. And the physical consequences you see here, the dramatic weight loss, the loss of menstruation in women, are all direct outcomes of this intense psychological struggle. And if you take one thing away from this section, let it be this. Eating disorders are not lifestyle choices. They're not a phase. They are serious, complex, and potentially fatal medical disorders that require real medical and psychiatric care. Getting that right is absolutely the first step. Okay, let's shift gears. Now we're going to look at how this mind-body link gets stress tested during some of life's biggest events, specifically childbirth and the universal human experience of loss. The time after having a baby is one of huge physical and emotional change. And while a lot of people know about the postnatal blues, for some, it's much, much more serious. Check out this number. About 1 in every 500 new moms experiences postpartum psychosis. And let me be clear, we are not talking about just being depressed. This is a severe psychiatric emergency that needs immediate medical help. Now let's talk about something every single one of us will face: grief. And our source material is really clear about this. Normal grief is not a disorder. It's a natural, healthy, and necessary response when we lose something or someone we love. It hurts, of course it does, but it's a process we're built to go through. So how do you tell the difference between normal grief and clinical depression? It's a crucial question. This table lays it out. Look at self-blame, for example. In grief, you might blame yourself for things related to the loss. But in severe depression, that blame is global. It's about everything. You feel worthless. And knowing this difference is so important because it changes everything about how you'd help someone. Okay, so what happens when our emotional pain doesn't have words, but shows up in our bodies as real physical symptoms? This is where we get into the really fascinating and often misunderstood world of psychosomatic disorders. This is the textbook definition, and it really gets to the core of it. A psychosomatic disorder is not all in your head. The physical symptom, the pain, the rash, the stomachache, is 100% real. The idea here is that psychological stress is either kicking it off or making it way, way worse. And this model here, it explains the modern way of thinking about this perfectly. It's called the biopsychosocial model. It just shows that our health isn't just about our bodies. It's a constant dance between our biology, our psychology, our thoughts and feelings, and our social world, like our jobs, our relationships, our stress levels. Illness often happens right there in the middle, where all three of those circles overlap. So, knowing all this, how does medicine actually put it into practice? How do we stop treating just a set of symptoms and start treating the whole person? Well, one of the key answers is a specialty called consultation liaison psychiatry, CL for short.
So picture a psychiatrist who doesn't work in a psych ward, but who works right alongside surgeons and cardiologists in the main hospital. Their entire job is to bridge that gap we've been talking about, to treat the depression that comes with a cancer diagnosis or the anxiety that comes after a heart attack. It's truly integrated care. Because ultimately, that's the goal, right? It doesn't matter if it's an eating disorder or postpartum depression or a psychosomatic condition. The goal is to look past the diagnosis on the chart and to see the whole, complete person with their entire story.
Which brings us to one last thought to leave you with. We've seen how powerful this conversation between our minds and our bodies truly is. So the question is a personal one. Are you actually listening to your own conversation? What is your body trying to tell your mind? And what is your mind trying to tell your body? Thanks for joining us.